Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about gout. We'll keep it simple. What it is, who gets it, how doctors diagnose it, how to treat an attack, how to prevent future attacks, and what to avoid. Doctor, in simple words, what is gout?
Gout is a type of arthritis caused by uric acid crystals in a joint. Those crystals trigger strong inflammation. That's why the pain can feel shocking.
People always mention the big toe. Is that the main place?
The big toe is very common, but gout can also affect the ankle, knee, foot, wrist, fingers, and elbow.
Where does uric acid come from?
Uric acid forms when the body breaks down purines. Purines are naturally in your body. Purines are also in some foods. Normally, kidneys remove uric acid in urine. If the body makes too much or kidneys remove too little, uric acid builds up. Then crystals can form.
So who is at higher risk?
Being male and getting older, family history, kidney disease, excess weight, high blood pressure and diabetes, alcohol, especially heavy use, and some medicines, especially certain water pills.
Many patients ask, did one meal cause this?
One meal usually doesn't create gout by itself, but certain foods and drinks can trigger a flare in someone who already has high uric acid. And gout is not only about food. Kidneys and genetics matter a lot.
What does a classic gout attack feel like?
It often starts suddenly. One joint becomes very painful, red, hot, and swollen. The pain can peak fast, sometimes within hours. Some people can't even let a bed sheet touch it.
Important safety point. How do we know it's gout and not a joint infection?
Great question. A hot, swollen joint can sometimes be an infection. If there is fever, chills, feeling very sick, or the joint is rapidly worsening, seek urgent medical care. Doctors may need joint fluid testing to be safe.
How do doctors diagnose gout?
The most certain test is joint fluid. Doctors look for crystals under a microscope. Blood uric acid can help, but it's not perfect. Uric acid can look normal during a flare. Ultrasound can also help in some cases too.
Now, treatment. When someone is in a flare, what is the main goal?
Calm inflammation quickly and control pain safely. Starting treatment early often helps the flare settle faster.
What medicines do clinicians commonly use for an acute flare?
3 common options. Anti-inflammatory medicines like NSAIDs, if safe for the person, colchicine, especially if started early, or steroids.
People hear the phrase steroid infiltrate. That means steroid injection into the joint?
Yes, a clinician can inject steroid into the joint. It's most helpful when gout is mainly in one joint, but infection must be considered first. This should be done by trained professionals only.
Now the big confusion. Is gout treatment short-term or long-term?
Flare treatment is short-term. It's to stop the attack. But many patients need long-term control to prevent future attacks and joint damage.
When should someone start long-term uric acid lowering treatment?
When flares keep coming back. When there are tophi, which are uric acid lumps under the skin. When there is joint damage from gout. Or in higher risk situations like kidney disease or kidney stones.
What are the common long-term medicines? Just names, no dosing.
Common long-term options include allopurinol. Another option is febuxostat for some patients, and probenecid is used in selected cases. These lower uric acid so crystals stop forming. Over time, old crystals can slowly dissolve.
Patient question. Can long-term uric acid lowering treatment be started during a flare?
With clinician guidance, it can be started during a flare with anti-inflammatory cover. And if a flare happens while someone is already taking long-term treatment, they usually continue the long-term medicine and treat the flare.
Another fear patients have. Will I get more flares when I first start uric acid medicine?
That can happen early, so clinicians often add flare prevention medicine when starting long-term therapy. This prevention is commonly continued for at least 3 to 6 months.
Now the goal. What uric acid number are we aiming for? Is it different for men and women?
The target is generally the same for men and women. The usual goal is below 6 milligrams per deciliter. In severe gout, like tophi or very frequent flares, clinicians may aim for below 5 for a period of time. The key idea is treat to target. We check uric acid and adjust the plan until the goal is reached.
What complications can happen if gout is not controlled?
Repeated flares can damage joints over time. Tophi can grow and limit movement. Kidney stones can happen in some people, and quality of life can drop because of pain and missed work.
Prevention time. What lowers gout risk and reduces flares?
Drink enough water. Work towards a healthy weight. Move your body regularly. Limit alcohol, especially heavy use. Avoid sugary drinks, especially drinks sweetened with high fructose corn syrup. And keep follow-ups if you need long-term urate control.
Foods to avoid or limit. Keep it simple for our viewers.
Limit organ meats like liver. Limit large amounts of red meat. Be careful with some seafood like shellfish and sardines. Avoid sugary drinks. Choose a plan you can keep. For many people, low-fat dairy can be a helpful choice.
Medicines to be careful with?
Some water pills can raise uric acid, but do not stop blood pressure or heart medicines on your own. Ask your clinician if safer options fit you. And if you take low-dose aspirin for a real medical reason, don't stop it without medical advice.
Any safety note about allopurinol?
Rarely, it can cause a serious allergic skin reaction. In some people, clinicians may consider a genetic safety check before starting it. This is why long-term medicines should be supervised.
Quick do and don't.
Do treat flares early with safe medical guidance. Do rest the joint, use ice if it helps, and stay hydrated. Do seek urgent care if there is fever or you feel very unwell with a hot, swollen joint. Do ask about long-term therapy if attacks keep coming back. Don't assume every hot, swollen joint is gout. Don't mix medicines without checking kidney, stomach, heart, and drug interaction safety. Don't stop long-term urate-lowering therapy suddenly if your clinician prescribed it for long-term control.
Short recap before we close.
Gout is arthritis caused by uric acid crystals. Acute flares are treated short-term to calm inflammation. Many patients need long-term urate-lowering therapy, with flare prevention for 3 to 6 months when starting. The usual urate goal is below 6 for men and women, and sometimes below 5 in severe cases. The long-term win is a plan you can keep with safe medicines and realistic lifestyle habits.
Thank you, Doctor. Thank you for watching Dr. Health Hub. This episode is for education only and does not replace personal medical advice. Don't forget to like, share, and subscribe for more trusted health tips. And remember, your health is your wealth. Stay tuned for the next doctor tip you can trust.